So there's so many chemicals in our body, and to pick on just one certainly doesn't make much sense. But some people think of nuclear factor kappa B as a master switch, an important thing to look at. It's a transcription factor. That is a messenger molecule that is activated by carcinogens, either internally produced or from our environment, oxidative stress, viruses, regular stress. All of this is in a decent literature. Inflammation, radiation and chemotherapy. And it's associated in a wide variety of tumors. It signals more than 400 genes involved in the proliferation, anti-apoptosis, angiogenesis, invasion, and metastases. And much research focuses on, well, how can we manipulate this for the benefit of the patient? And dietary inhibitors of nuclear factor kappa B, it's a long list: almonds, anise, basil, black pepper, all these spices. All of these are in decent journals. Lots of spices, the cumin, curcumin, fenugreek, etc. Licorice, mango, and licorice is a part of a lot of herbal tonics because it's a nice blending agent. But many of the wonderful herbs you use in cooking, etc., are all decent inhibitors.
Dr. Ross, I'm curious about the previous slide. Were you saying, are you saying in that slide that nuclear factor kappa beta, which is a master switch for cancer, which in my mind means it's a trigger, is that an accurate assumption on my part?
You know, it's a normal chemical in all of our bodies.
Okay.
And it does many things that are important to maintain cellular tissue health. But when overexpressed, it can create problems.
Okay. So my question is that slide saying that radiation and chemotherapy, which are obviously treatments in cancer, further exacerbate the negative impact of KF?
Can, and yes, and again, you know, the issue is to provide, these are toxic, you're trying to kill cells, and they do injure the body, and this is a reaction to injury. Now, again, some of the things that you might do that would modulate its long-term negative effects, because you'd like your chemo to go in, do its injury effect, and then have your body recover as quickly as possible, or your radiation. So you don't want to not allow the injury process to occur optimally when you're subjecting yourself to the chemo or radiation. But what you would like to do is support a rapid recovery and minimize the debilitation that for some people occurs. And so that's the point.
Thank you.
And so, you know, in a lot of the supportive programs that include complementary alternative therapies, many of these herbal products are used. Again, attention to, you know, dietary programs that might be helpful, unique herbal supplements that might be useful. You're not trying to negate the effect of your chemo and radiation. You don't want to do that. You want it to kill these cells, but then you want to see if you can recover normative function quickly. And additional strategies to help lower inflammation include optimizing blood sugar, again, the metabolic syndrome. It's all circular. Reduce excess body fat, because adipose cells aren't just sitting there, they're biochemically active, they're endocrinologically active. They secrete inflammatory compounds, and as I told you from the little experiment my son and I did, it raises C-reactive protein. Support adequate sleep, maybe one of the hardest things to do when people are so ill. There's been a study with Qigong that, you know, just normative, the breathing, that somehow it really does support, and this is where you get into this idea of the energetics. You know, what do we mean by that? Maybe just optimizing diaphragmatic movement and oxygenation of tissue, etc. really does help. And reducing stress, easier said than done. General exercise and physical activity, and of course, a good chuckle. So pretty soon I heard at Hopkins they're going to have like old Marx Brothers
Oh,
in
yeah.
the chemotherapy suite.
I'll go.
And this is just an anti-inflammatory protocol that I've made simplistic. And for those who want to stay around, I'll tell you what's in things like Inflammaway. But rather than multiple products, I thought I would just point out a fairly simple thing that one might do with a product called Inflammaway, which has curcumin and other anti-inflammatory herbal products, bromelain, which is really the enzyme derived from pineapple core, fish oil, and then quercetin with extra bromelain to enhance its absorption. So the next theme then is hypercoagulability or sticky blood. Cancer cells are capable of producing fibrinogen. Macrophage infiltration is a kind of a white cell that goes into the tumor, yields excess inflammation or creates it that can trigger the liver to produce additional fibrinogen. And elevated fibrinogen levels leads to red blood cell aggregation, stickiness. In the capillaries, which are these tiny, tiny little, the end of the arterial vascular chain is trying to get oxygen to your tissue and nutrients to your tissue, it just bungs them up. And it creates hypoxemia, a low oxygen state. And hypoxemia stimulates new blood vessel growth and may contribute to resistance to radiation therapy and chemotherapy.
So that last part again, just say that.
Inadequate oxygen to the tissue that you're trying to treat, to tissues, may contribute to resistance to radiation. And I mean, it is believed that it does. And much work is done on trying to figure out, well, how could we, knowing this, what could we do to optimize oxygenation of these tissues so that they would be more susceptible to the radiation and chemo we do. And the tumors use fibrinogen to bind and acquire growth factors, vascular endothelial growth factor and other endothelial growth, other angiogenic growth factors. And elevated fibrinogen contributes to metastases because these cells are looking for a blood vessel to hook onto. When it's stickier and more congested, it gets easier. And so these are natural inhibitors of fibrin. Atractyloides, which these are just, some of them are a little bit esoteric. Bromelain, cayenne, which isn't so esoteric. Curcumin, which is a standard herb, but when done in much bigger doses can be helpful. Danshen or salvia. Feverfew, which is a very valuable herb, and then good essential oils. I'm even moving away from saying fish oil and saying a balance of healthy essential oils, which includes some omega-6 oils as well as some omega-3s. Garlic, ginkgo, lumbrokinase, which is actually quite effective, but unfortunately very expensive. It's an enzyme complex from the earthworm. How they figured that out, I'll never know. Magnesium, maybe. Nattokinase, which is an extract of soy. Chinese peony, and then mixed, vitamin E is mixed tocopherols. And this might be a simple protocol. The bromelain, again, the Inflammaway. This beyond essential fats, this fella from Natura created, has the healthy omega-6s plus omega-3s. Pycnogenol, which is an extract of pine bark, which has been shown to lower fibrinogen levels in C-reactive protein, and then a nattokinase. I'm not telling everyone to do this because it would truly be